Hi, I'm Professor Dr. Ashish Davalbhakta at Aesthetics Medispa and Advanced Aesthetics in Pune. In this educational video, we are going to cover some of the common risk or complications that one can encounter following a blepharoplasty. Blepharoplasty is a procedure that your surgeon may recommend for you to correct the aging changes around the eyes or the eyelids. So blepharoplasty is a medical term for eyelid surgery and mostly done to smoothen out the eyelid wrinkles and folds and bags. Commonly asked question once your surgeon has told you that you need a blepharoplasty is what are the risks and complications that I might encounter. Commonly it's a fairly safe procedure. It's a straight and standard straightforward procedure that doesn't lead to any risk or complications. But as in medical field, there's nothing that one can assuredly or guaranteedly say will not lead to risk or complications. So in the rarest of rare situations, we do have to face something. So I'm going to mention those. One of the commonest things that happen that one may not even consider to be a complication is bruising. And if you look in this picture here, this is a maybe 2-week picture post-op where a little bit of bruising is evident around the eye. The eyelid skin is fairly thin. When you lift the eyelid skin up, if even a little bit of thin layer of bleeding that or blood accumulates in that plane, that's going to be visible outside as a bruise. And that in due course of time, as up to 3 weeks, it breaks down, that blood breaks down and body clears it away. So a bruise disappears, but it goes through the various hues, as you can see in this gentleman's picture, where it has become green, then yellow, and then gradually disappears. So it takes around 3 weeks for that to happen. So one should not keep any social commitments, because even in the best of hands, you cannot prevent a bruise even if you try your level best. So bruise is one of the commonest things. There is swelling around the eyes, and eyelid skin tends to swell considerably. It's very thin. And the thinner the skin, the more lax the skin, the more swelling you will get. And the swelling can take anywhere between 6 to 8 weeks for majority of the swelling to go. That means around 80-85%. Rest of the swelling may take even up to 3 months, sometimes 6 months to disappear, and it stays at the eyelid margin mostly. So that is something that you can help to get rid of by massage, but it's a normal thing. I wouldn't even consider it to be a complication or a side effect. But yes, it would affect your social appearances in case people notice that your eyelids appear swollen. So there may be some of you who would need to know what kind of swelling you are likely to get and how it's going to affect your social appearances. Another thing that one has to look out for is excessive drying of the eyes or watering of the eyes. And it is usually associated with a condition called chemosis. So that means that there is a puffiness or swelling of the conjunctiva, and sometimes the conjunctiva becomes dry because the eyelid is unable to close during the sleep or during the daytime. And that happens because of the swelling, or sometimes because of tightness of the tissues. And the rarest of rare situation is if in case that excessive skin has been taken out by your operating surgeon. And that is a complication, where if more skin has been taken out than necessary and your eyelid doesn't close, then the eye or the conjunctiva and cornea is going to get exposed, dry, and because of that you will have excessive watering or blurring of vision and even complications. So one should massage to allow for the swelling to disappear or go away, and that helps the eyelid to then close properly. You may even tape your eyelids shut if in case they are not closing during the night time. You can keep a shield or wet cotton wool, something like that, so that excessive evaporation doesn't happen. And in case you do find that these things are not working, it is best that you contact your surgeon, who will then think about something like a tarsorrhaphy or a stitch to temporarily hold it together till the swelling settles down. If in case none of these things are working, then definitely you may need to think about adding skin so that the eyelid closes properly. But this decision is not usually taken for at least 3 to 4 months, allowing all the swelling to disappear, the skin to loosen, and the tightness to go before you even have to consider adding skin to allow the eyelid to close. So Lagophthalmos, where the upper eyelid is not closing, that is a complication that can happen with an upper eyelid surgery. Or ectropion, where the lower eyelid is getting pulled down because of excessive removal of skin from the lower eyelid, and that can also happen not just because of excessive skin being removed, but it can happen because your eyelid is very lax, loose, and the swelling and edema is causing the eyelid to sag down. So if you see this picture here, this is a picture, an appearance of lower eyelid ectropion, where the whites of your eye are visible, and that is because the lower eyelid during the healing process and the scarring and cicatrization is pulled down. Now, most of the times, simple massage in an upward direction can help in relaxing the lower eyelid, and the eyelid lengthens and becomes normal. But if your surgeon hasn't taken the necessary steps to prevent ectropion from happening, and that step is called as canthopexy. So now modern eyelid surgeons, they will incorporate canthopexy or a canthoplasty, looking at the laxity of your lower eyelid. If it is very lax, then you may need even a canthoplasty, which is lower eyelid shortening, or just a canthopexy where it is anchored to, up in a higher position till the swelling settles, until the healing process gets over, and then it settles down to a normal appearance. So sometimes after surgery, you do see that your eyes are pulled laterally and it looks a little stretched. This is normal. It is because of that canthopexy and the way tissues have been held and the swelling that your eye may look like it is a little stretched, but that settles down by 6 to 8 weeks. So just be patient and that will all settle down. It's all meant to prevent an ectropion and prevent the whites of your lower eyelid from being visible. A worse complication than this is something that is very rare, but one needs to be aware. It's mentioned in the literature, but as I said, very rare, and that's hematoma, or a blood clot in the lower eyelid area. If you bleed inside, then it can put pressure on your globe and it can affect the vision, not only blurring, but sight can be affected too. And the operating surgeon will look out for all of these things and keep an eye out and ensure that timely action is taken if anything like this is picked up. So apart from this, as I said, that all these complications are rare and they are part of the normal post-operative recovery, and by 6 to 8 weeks or maybe 3 months at the most, all of it settles down. The eyelid swelling is the one that takes the longest to go, but it goes and it starts looking a lot better, and then the benefit of the surgery is appreciated. Thank you.